A very good evening to everyone. Welcome to Kopi with Vance. As usual, this is the cup with Kopi with Vance, and cheers to everyone. Thank you for tuning in today, and thanks for the accommodating of the time. We planned was actually at 9 p.m., but we have discussion going on to make it even more later so that more viewers can actually come and join us for these great topics. And I have got to thank every one of our viewers who have been supporting and giving great feedbacks and ideas to how to make Kopi events even a more interesting topic to come by with almost about 8 months since the pandemic COVID-19 has started. There's a lot of interesting topics and discussion as it came in, and we know that most of the people are probably at the phone before going to bed, and so we decided to push even a bit more later to make it like a late night show. So I hope you all enjoyed the session today. Today's topic it's about cancer. What you should know about cancer. I'm sure some of you all might have lost your loved one on cancers, and some might have certain questions in the mind how it came about or what is the cause about it, how it becomes, what are the things that you should do, like a regular checkups, so and so forth. So the best person to answer this is an oncologist, is Shazril Imran. Shazril Imran is a doctor and a consultant who's an expert in the cancer. He does a lot of in this practice in this field, so I'm going to bring him up in a while. But before that, I'm just going to give you a quick statistics on Singapore itself. This is by the National Cancer Center of Singapore. Just a quick short statistics. Cancer cases have been rising over the years, and we all know that the number of people living with cancer will continue to increase. During the period of 2013 and 17, a total of 71 over 1,000 cases were reported in Singapore. It's about 48.4%. And 51.6% of these cases are reported in males and females respectively. And it also cancer happens for males and females, so there's not a specific gender to be accurate only on males or females. But if we are looking at Kuala Lumpur in Malaysia, there's also 11.3% of increase in new cases from 103,000 in 2007 to 2011 to 115,000 in 2012 to 2016. So it's a bit quite alarming situation that cancer is being one of the deadliest disease, or it can attack anyone, regardless whether the person is fit or unfit. But what is really a cancer, right? Before I invite my speaker to come up, Dr. Shazril Imran, I'm just going to give a very quick a brief on the cancer. Cancer is the name of a collective related diseases. In all types of cancer, some of the body cells begin to divide without stopping and spread into surrounding tissues. I lost my dad in cancer about 2 years, 1 year plus, so I know how deadly it can be, and within instantly it can just take anyone out of it, right? Cancer can start almost anywhere in the human body, which is made of trillions of cells. All right. Normally, human cells grow and divide, form of new cells, and the body needs them. When cells grow old or become damaged, they die, and new cells take this place. All right. I'm no expert in the cancer field or research, but the best person to give us answers and to talk about it is Dr. Shazril Imran. So let's get Shazril Imran. Sir, how are you, Doc?
I'm fine. How are you, Vance? I'm a good man.
Good, doctor. I'm good. Thank you for joining us today. I
Thank
know
you
it's
for inviting as well.
thank you, doctor. It's a great pleasure to have you in this talk session because cancer is one of the deadliest disease.
Yeah.
Cancer can cancel anyone. But before we dive into the topic, doctor, I would love to have the privilege of introduction of yourself, please, doctor.
Right. Thank you very much, Vance. This is a very great initiative that you have done. Actually, your introduction just now, you've covered few of my slides already. So
Okay.
that's very well in depth, really. Thank you very much for that. So we can just reiterate the comments. I'm basically an oncologist, and I treat cancer patients with chemotherapy, immunotherapy, targeted therapies, and radiotherapies, and we try to cure cancer patients, for those who are in the stage 1, stage 2, and stage 3. And those with stage 4 cancer patients, we try to control the cancer as long as we can. And so I'm based in Penang. So I'm a resident oncologist in Sungai Petani, Kedah, and I'm a sessional oncologist in Pantai Hospital Penang, and also a visiting oncologist in Gleneagles Penang. I'm also a visiting lecturer at the National Science University of Malaysia, and I teach students oncology, cancer studies, and so on. So part and parcel of me is like I'm really engulfed with cancer all over in terms of teaching and also treating patients. So that's a very basic background from myself. I was trained in the United Kingdom in Manchester, and had my early studies there, my masters there as well before I returned to Malaysia. And It has been around coming to 5 years now. I'm practicing in Malaysia, and yeah, the enjoyment of practicing in Malaysia is entirely different. The challenge is entirely different in comparison to working in a developed country.
Thank you, Doctor. Thank you so much for the humble introduction. Before I know, Doctor, we talk about this topic about 3 weeks back,
Yeah.
and what puzzled me is because you are an expert in this field, but when you told me that you need some more time to plan and to do a great presentation to make sure that all informations are covered,
Oh dear.
so that really impressed me because that shows that how much of interest that you want to share your knowledge with a lot of our viewers. So I'm really humbled and grateful for that, Doctor.
Well, I'm really humbled as well, actually, Vance, for that compliment. But I wouldn't credit myself too much on that. Really, I think the gist of the talk. I can I really can give a cancer talk, but the gist of the talk should be easily understandable,
Agree.
with and without any jargons being used, and it's easily can be comprehended, and you get the take home message nice and clear. So to make those kind of slides and PowerPoint, it is entirely different than making a medical presentation really to our colleagues and so on. So that's why, I mean, we need to put a bit of effort to put everything in layman's term, so that everyone doesn't get bored, and you really get what you really need to know, really.
Thank you so much, Doctor, for that, because I know how much of work have to be done just to do that presentation because it's not
Uh,
scientific and easier to understand for layman terms. So I think thank you so much for the effort. Doctor, before
sure,
we jump into this topic,
sure.
because earlier in my introduction I said that I have lost my father with a
Uh-huh.
lung cancer, and it was stage
Sorry to
4.
hear.
But I want to
Sorry.
bring up this in this particular period of this topic because it just turned out to be a cough. He had a cough,
Mm,
right? Just like
that's
a
right. Yeah.
not even a worse cough, just like a normal constant cough. And he decided to have a checkup. And
Yeah.
when he decided to have a check, and then that's why the experts had say that possibility we need to do a scope and to do a check and
That's
to
right.
find out further.
Yeah.
And when we got the news, it was stage
Mm-hmm.
4, and
Yeah.
then the doctor say that you have 3 months relief. So when someone apart from the
Mm.
almighty or the one above us who give us the life, but at the
Yeah.
same time a doctor also says that what, you got 3 months to live. So it's a life changing event at that point of time for any
Yeah. Yeah.
with lots of emotional and also we knowing that we're going to lose a patient. It's not only for the patient, but it's also for
That's
the
right.
loved one. So I am sure in your field, you got to face with your loved ones with it's such an emotional stress. So I just want to ask you before we even jump into the slide, how do you because your environment is not a happy environment. I got to say that
That's
because
right.
you know
Yeah. That's right.
you got to be strong. You got to be. I do not know. I probably would not able to do that as a doctor. I would not be able to do that. But you are doing it you are doing it with passion and in serve of community. How do you do that, doctor? I want to start out with this with you.
It has never been easy, Vance. Even now, so to be fair, we doctors, we are also humans after all. Even oncologists, we are humans after all. Patients sometimes, I mean, what happens to patients, we are affected as well. And my family knows about it. So if I come back home with a sober mood and so on, they know something didn't go right with our patients and so on. And if I come back happy and we know that probably patients are doing better than we expect. It's never been easy, and as you say, it's a lot of emotions going on. At the same time, being a doctor, we just have to be as truthful as possible to patients and their family, not to give them too much of false expectation. At the same time, not to give them a too pessimistic view. It's really a fine balance that we have to strike. Really, at the same time, when delivering the news, you really have to be tactful. You really
Mm.
have to be really need to control the whole situation really to make sure that the person that you're giving the bad news, they are really prepared for it, they are really composed for it, they have all the adequate support for it before you really break the news. So we don't tend to break this news over the phone. It really has to be a very calm clinic setting that we break the news, and it's never been easy even now. What's more devastating is when we tend to see the younger populations. Some people, like for example, breadwinners, they get a terminal cancer, and we have to break news to them. They've got two or three small kids to feed, and they're just about to blossom in their life, and it's the end of it. That's really devastating, and that really shatters us as well. But it's just um, well, when the tough gets going, and when we just get used to it, really, it just becomes a bread and butter for us. But admittedly, even now, even many years of treating cancer patients, no doubt we are still affected. But we may not show in front of patients, but deep inside, yes, we are deeply saddened, definitely. As you say, um, uh, sadly, oncologists probably have a more pessimistic view about life, really, because we tend to see life and death in a very swift manner
Yeah.
in comparison to others. And this is being shared by our colleagues as well, who are our colleague doctors who are non-oncologists, and they say, "How can you work as an oncologist?" Even our colleagues are saying the same thing. And interestingly, is one of the studies being done in the UK years ago, and I think we are just diverting. I hope you don't mind,
No, that's
but
good.
it's just they were looking at the medical specialists. The life expectancy of a medical specialist, and the GPs and ENT surgeons have the highest life expectancy among
Okay.
everyone else. And the shortest expectancy you can actually guess is actually the oncologist. So so yeah, I mean, there is a scientific data, whether it can be explained or not, that we may be affected by our career really, and that is being shown by having a comparatively lower life expectancy than our ENT colleagues or than our surgeons and the specialists. So no doubt we are emotionally affected. So the life expectancy of an oncologist is around 72 years, whereas for ENT surgeon is 78 years. So yes, we tend to have a bit more pessimistic view about life, and that may have like affected our lifespan as well. So, but it's just part and parcel of life, really.
Doctor. I mean, you have just spoken from the softer side of
Yeah,
the doctor. Because you can't show your real the side of to a patient because
exactly. Not in clinic. We can't show this in the clinic, really.
yeah,
Yeah,
but then again, like what you explained the past 2 3 minutes. I know we have to dive into the topic, but I still want to
yeah.
cover this segment of your
Sure,
professional
sure.
role. Apart, I mean, there's no one in the world, I mean, the wide world right now to tell someone,
Hmm.
you got 3 months to live. You know what? You got one.
Yeah,
So you have rather that expertise, that medical background with science and research. You are trying as much as possible to
sure,
prevent
sure.
it, a possibility to cure it. But I think before I start on, I got to say, thank you, doctor, because doctors are the angels that sent down by from the top. Because you guys are the one who are taking care of the humans. So thank you, doctor. Thank you so much, and
Yeah.
we should dive into the topic now.
We're just doing our part, really, Vance, and we
Thank
are
you, doctor.
mortals after all.
Thank you. So viewers watching out there, please do share this video. It's a late night show. We want to do
Mhm.
it at 10 p.m. with Dr. Shazril. Imran is here. Is an expertise in the cancer, where he's going to talk about all about the perfect presentation as much as we want to cover. So please do share and like this video so that it can reach out to more people and hopefully it can benefit. Doctor, we're going to pull up your presentation right now.
Sure, off we go then. Okay, could you see that clearly, Vance?
Yes, doctor, I can see you clear.
Right. So, thank you again, Vance, for the opportunity of sharing some knowledge about cancer. And as per what we have discussed before, Vance, is the topic should be clear, concise, and simple because we just want to get the message across. So, the topic today is what you should know about cancer, what the public should know about cancer, and the C word is the word that comes with a lot of stigma, a lot of dilemma, and a lot of myths as well, which needs to be ironed out, needs to be clarified so that you don't get any misconception about cancer. So this is a slide that I've mentioned earlier that Vance have covered it very succinctly, excellently, but it's fine that we can just reiterate the same points really, just to strengthen the point to know about cancer. So what is cancer? Basically, cancer is cells that belongs to our own body, and these cells they have mutated to become nasty cells. And when we say nasty cells, they cause damage. They cause damage to your body by either causing mechanical, biochemical, or hormonal damage to the body. And this is as a result of a DNA mutation. So, cancer is a DNA based disease, and any mutation may trigger cancer. So, it may trigger irregular growth of normal cells to become cancerous cells. And when these tumor cells, these cancerous cells, they become irregular, they stop listening to the central command, meaning they stop listening to our body when not to grow, when to grow, or when not to press on other cells and so on. So it just stops listening. It becomes a very rebellious. It grows, it colonizes, then they invade the organs, the affected organs that they grow. After that, they breed into millions, into billions, then they spread all over. So, in a just 1 centimeter of a cancer cell would have billions of cells, cancer cells in it. So that's why cancer can be challenging to treat. But with the current treatment that we are seeing a lot of progress, a lot of success in trying to cure cancer or in trying to eradicate and prolong the life of cancer patients. And this is what this chart can just summarize what I've mentioned before. So any DNA mutation can inactivate the tumor suppressor gene. There's a gene in our DNA that controls the regulation of normal cells growth. When this tumor suppressor gene becomes inactive or it becomes faulty, then the cells tend to proliferate. It tends to breed from 1 to 2 to 4 to hundreds to millions and so on. And this proliferation then further activates other pro-cancer genes. It's called proto-oncogenes, and this again inactivates other tumor suppressor genes until it becomes a vicious cycle, and this vicious cycle leads to what we call as cancer that we can see visibly. And from there onwards, then we start seeing the cancer start breeding, growing, and spreading all over the important organs in the body, and then it starts to damage these organs. For example, it starts to damage the liver, starts to damage the lungs. Patient will be breathless. It starts to damage the brain. Patients may present with a stroke, or it starts to present to infiltrate the spine, and patient can present with paralysis. So it is a very a devastating disease when it comes to the stage where it has spread. So what causes it really? What causes cancer? What causes the DNA to mutate in the first place? I tend to divide into two, whether it's inherited or is acquired. Inherited means that the person's DNA is already defective to begin with, and come to a certain age, this defective DNA start to produce cancer cells. So the DNA may have been inherited from their ancestors, from their parents, either from the paternal side or from the maternal side, and or from the grandparents and so on. And this inherited DNA comes to a certain point, comes to a certain age, it is being triggered by itself or by any other factors, and that would lead to the beginning of the cancer growth. The other hand is the acquired. The acquired mutated DNA, either it happens on its own without any reason that we have known so far, or by factors, by environmental factors, or by lifestyle factors surrounding us. As far as we know now, we can actually pinpoint the reason for a patient to get cancer. I mean, 30 to 40% of patients, we can actually pinpoint the cause of it. 60 to 70% of patients getting cancer, we just don't know why they get cancer, and it's just random luck. You can put it in layman's word. Well, the 30 to 40% are the things that you can actually try to modify, try to reduce the risk factors, and try to educate patients from preventing themselves from getting into cancers by trying to avoid all the environmental and lifestyle factors.
Doctor,
As
sorry.
Yes, Van.
That's maybe probably a quick question. If we can go back to the previous slide.
Sure.
That, I mean, of course, there is three factors that we are looking here right now:
Yeah.
environmental factor, lifestyle factors, familiar
Yeah.
risks or symptoms, and DNA.
Yeah.
Of course, but of course, I know, doctor, we have something that line up along the way. But I thought this area, if I probably can ask you a question, so that it might be
Yeah.
useful for viewers or even for
Sure.
myself. Is there a certain age that a person should go and do their tests to make sure that even though they can be fit, they can be eating healthy, they look good, they sleep
Yeah.
well, drink
Yeah.
all the alkaline water, they
Yeah.
take all the organic food, so and so forth. Family histories are great, ancestors really, I mean, so far they assume everything's great,
Yeah.
but there a certain age where they need to go and check.
It's a very valid point, Advance. So it depends on the type of cancer that we are looking for. For example, for females, we would advise women to go for a mammogram screening test when they start reaching the age of 50. In certain countries, it will probably say 40. The same goes with bowel cancer for males and females. So for bowel cancer, the screening age starts at the age of 50. Now, if you have a family history of bowel cancer, for example, if one of your family members has bowel cancer and he got it at the age of 45, so you have to start screening 10 years before the age that he presented with. So meaning to say, at the age of 35, you need to start checking yourself, not just for bowel cancer, if possible for any other sorts of cancer. So meaning to say, it depends on your risk factor. If you have family history, then we take into account the age of diagnosis of your family member, and then we normally ask you to screen probably like a decade before. If you don't have a family history, then we follow the general screening advice. For example, in the United States, they would advise people to go for screening for bowel cancer at the age of 50. For lung cancer as well, they try to do a CT scan, a low dose CT scan for people age 50. And the aspiration is there, but it's always the financial constraint by these countries to implement that actually deters them from rolling out en masse. Um, but there is no certain cutoff age for all sorts of cancers, really. What we have clear so far is for bowel and for breast cancer. Now, for the cervical cancer, cancer of the cervix, the Pap smear, the cervical smear starts at a very early age. Even at the age of 20s, you can go for a Pap smear test. So, depending on each type of cancers, there are certain age that it needs to be triggered. There are some sort of like odd cancers, for example, liver cancers or pancreatic cancers. These are relatively rare cancers where we don't have a certain guidelines on when we should be looking for these cancers, when we should be screening ourselves for, and there is no robust test as well apart from doing a CT scan. And again, there's a lot of counseling has to be done because we are exposing patients to radiation by doing CT scan and so on. So at the moment, I would probably say if somebody is concerned, better see an oncologist or see any of your family doctor and discuss the risks. If you have some lifestyle risks or you have a familial risk, then probably we can have a customized plan for that particular patient of concern, and then we can sort of make a plan for them. By this age, you should go for this. By this age, you should do this and that.
Thank you, doctor. I mean,
Yeah.
thank you for that. Because of course, as you're going through your presentation, I just have to stop for that
Yeah.
question.
No
But
worries.
but there's a safety marker
Yeah.
for cancer, right? What is there a certain marker that everyone should be, or is it varies for different for male and female?
Yeah, even the markers as well. It varies as well, once from male and female, and it varies as well for different type of the different types of cancers. We don't really we cannot really 100% rely on markers from your blood test, and they are not foolproof at all. A patient might have a stage 4 cancer, and their tumor markers from the blood test is normal. So internationally, we never recognize tumor markers as a reliable tool to determine whether the patient has cancer or not. So it has to be a thorough examination and so on. Some patients may have elevated markers, but when we screen them, in fact they don't have cancer at all. The markers are elevated just because their body produces those kind of markers, they may have other non-cancerous disease that elevates the markers. So bottom line to say, we don't have a robust tumor marker yet that we can actually one size fits all, or it can explain all sorts of cancers and so on. We don't have it yet. It is currently being researched, being developed in Germany, in Europe, where they look at the circulating tumor DNA, where at times the tumor shreds the DNA into the bloodstream, and you can actually measure the circulating tumor DNA. But that is still at very experimental level. It is not commercialized yet, and we cannot roll it out yet. And by doing that test, they're postulating that if we do the circulating tumor DNA, you can sort of like predict your risk of getting any sorts of cancer 6 months down the line. So if we have that kind of test, it will be really robust, meaning in 6 months' time, you know that you are going to get cancer or you're not going to get cancer. And you can just keep repeating the test every 6 months. But again, the test is still very experimental, it's still not fully proven yet. So at the moment, we are just relying on patient's history, if they feel well or they feel unwell, and the blood test coupled with scans, really either you're doing a CT scan or doing a PET scan and so on, then you could tell whether a patient has a cancer or not.
Thank you so much, doctor, for this information that you have just passed. Because there are so many. I think countless numbers may have lost their loved ones for cancer.
Yeah, that's right.
I mean, most of them were, praying for miracles to happen. Um,
Let's hope
I,
for it. Yeah.
I'm going to ask a very difficult question. I'm sorry about that, but
Sure, no worries.
is there a cure in the near future for cancers? I mean, will there be like a tablet or something like, yeah, I do not know because it's like a corrupting file in the entire
Yes,
body.
exactly, exactly. Yes.
Virus where boom it clears, or because a lot of because I can relate to that particular situation, because when I was losing my father day by day in a 3 months
Mm-hmm.
period, we know
Yeah,
that his last day is going to come in the next 3 months. So we want to
yeah,
spend a lot of time with him, but then same time, faith
yeah.
and religion. We also want to pray that something miracles will happen, and also it's
Sure.
more for the loved ones
Yeah,
emotionally. uh,
yeah.
um, Psychologically, that you dry, but emotionally you're down. So do you think in the near future, maybe we're talking about 10 years to 20 years or even 30 years time in the
Yeah.
future, there will be something like a breakthrough on cancers?
Yeah, the treatment for cancer is very personalized at the moment, Vance, where there is no like one magic tablet that fits all. For example, for lung cancers, there are treatment for lung cancers to prolong life, but not to cure lung cancers at the moment. There are newer treatments for that, and for breast cancers as well, and for colon cancers. Now, the nearest that we have got so far, if you're talking about breast cancers in the UK, the Cancer Research UK they have made an aim really that with the adequate screening, meaning detecting patients at earlier stage, number one, with the robust treatments that we have at the moment, robust surgical techniques, robust chemotherapy and radiation therapy, in the year 2050, they are hoping that none of breast cancer patients will die of breast cancer. So they have put that target that in the year 2050, with the combination treatment of screening patients early, treating it early, treating with all sorts of treatment and so on, with the more novel treatments to come, that none of breast cancer patients will die of breast cancer. That's the nearest that we have got so far. And at the moment, the current UK statistics for 5 year survival of breast cancer is 90%. So we are not very far away from that really in that part of the world. But for other sorts of cancers, for example, liver cancers or pancreatic cancers or lung cancers, the survival rates are still low, despite whatever that we do, despite the newer treatment agents that we have. We can sort of like prolong their life, but we can't actually cure them if they are in stage 4 disease. And also to relate to your what you've mentioned before, your late dad had symptoms of cough and just a couple of months of cough, and then we found out that it's a stage 4. um, Lung cancer behaves as such that 75% of lung cancers would present in stage 3 and stage 4. So
Wow.
75% of lung cancers, yes, they present in stage 3 and stage 4. 50% of lung cancers will present in stage 4. Very, very rarely ones that we can actually catch lung cancers in stage 1 or stage 2. Because early stage, meaning the tumor is relatively small in size. For example, if it is stage 1 lung cancer, the tumor has to be less than 2 centimeter and it hasn't spread. If it is stage 2, it's probably less than 5 centimeters. So when we're talking about it, really, for such small size of tumor, you would hardly have any symptoms. So for that reason, that patients would always present late, stage 3 or stage 4, by the time they have symptoms. Not that they don't actually disclose the symptoms to the doctors, but by the time that they have the symptoms, it's already a late stage. It is a very challenging disease, actually, Vance, and it's a very a tricky disease to treat as well, and a very cunning disease to treat as well. So a lot of multimodality effort has to come in, where there isn't any one magic pill that actually can cure cancers, and we are using like many different drugs now. There are more than 50 drugs that we are using now for cancer alone, different drugs for different sort of cancers, and we are edging towards it. We're inching towards achieving cure for all sorts of cancer, but we are not there yet.
Thank you, doctor. Thank you so much for that brilliant way of explaining. At least there's some light at the end of the tunnel, because by
Yeah,
for breast cancers, there will be
yeah,
no fatality. I mean, of course, if every country follow the procedures, I think
exactly.
early prevention, medications, and to keep it everything as at a low as possibility. So
Yeah,
which is a good thing. We have certain markers there. Thank you, doctor. So I will not hold you on your presentations, so you can
no worries.
go your presentation, doctor. Thank you so much.
Okay, sure, Vance. You can just stop me at any time. No worries, Vance. Okay, so next slide is what are the common types of cancers? I'm just sharing the Malaysian data. So in the year 2018, from the WHO, the most common cancer is breast cancer, where there were like 7,500 cases, followed by colon cancers, 6,100 cases, and lung cancer comes third, and then followed by the nasopharyngeal cancer. This is the cancer of the back of the nose. A popular Malaysian figure who had this nose cancer is our badminton shuttler,
Yeah.
national badminton shuttler Lee Chong Wei. He had it, and again, there's a point to learn from. He had this cancer at a very young age. He was just in his mid 30s that he caught this cancer. So cancer really doesn't know, that doesn't recognize, doesn't happen based on age alone, and being such a fit and young patient, well looked after. Again, he still can't escape from cancer. That's how cunning cancer is as such. And after the nasopharyngeal cancer, you have liver cancers, and normally liver cancers is attributed to hepatitis, which is fairly relatively more prevalent in Malaysia than in comparison to developed countries. And people would ask that, is cancer, is it transmissible to surrounding people? For example, if any of our family members have got cancer, if we are sitting next to that person, will we get cancer? Or if we are sharing the food with that same person, are we going to get cancer from him? No, it is not a transmissible disease. We call it as a non-communicable disease. So example, if you are sharing a plate of noodles with your father who has a cancer, and you're perfectly safe to do so. And you're perfectly safe to actually, even like for example, a husband and wife, they're perfectly fine to have sexual relationships and so on, and it doesn't get transmitted. And this is again, a lot of patients, they get into this kind of dilemma, that they start actually restricting themselves unnecessarily with their family members. Some of them, they even don't sit on the same couch together. Some of them will have the plates and forks and spoon and all the cutleries separate from their family members, being afraid that the family members would get the cancer that they have. So this is very unfounded, and this has to be ironed out, and this has to be addressed. That yes, it's absolutely fine for you to share toilets, share cutleries, share the same plate of food with cancer patients, and you will not get it transmitted to you. Is cancer dangerous? Yes. I mean, the C word itself, it sends shivers down to our spine. It can be lethal. At the same time, it can be debilitating. This picture shows how much the cancer has eaten up the muscle mass, the protein from this lung cancer patient. This is a stage 4 lung cancer patients, and you can see he's a bit yellow as well. The teeth are a bit yellow. He's jaundiced as well, meaning to say this cancer has attacked his liver, and he's got some lines into his chest to suggest that he cannot actually eat, have the appetite to eat, and he's on nutritional supplements, milk and so on, to replenish him. And often when we see cancer patients who are as skinny as this, meaning to say, often they are already stage 4. The definition of stage 4 is the disease has spread or it has disseminated, causing mechanical, hormonal, or biochemical disruption. The vital organs that actually being the reason why a patient would succumb to cancer would be the liver, the lung, the bone, or the brain. If the cancer has spread to the liver, the patients will be jaundiced, they might get confused, they might get into coma, they might get the ankle swelling, leg swelling, they might get abdominal swelling, a lot of fluid that they have to drain, they might even get poor oral intake. If the cancer has gone to the lungs, then they may get water in the lungs, they will get breathlessness, they are dependent on oxygen. If they've gone to the bone, they may get paralysis, they may get severe bone pain, they may get fractures. If the cancer has gone to the brain, then they may present with stroke-like symptoms, weakness on one side, slurred speech, or even coma as well. So it is a very dangerous and debilitating disease. And if somebody has cancer, the next knee-jerk reaction that people might ask is what type of cancer and what stage is he in. Now the stage is really important for us because the stage will determine the chances of cure. Now if somebody presents with stage 1, this is for all sorts of cancer. This is a very ballpark estimate figure. You really can't get it wrong from the actual figure. And it's very easy to remember as well, Vance, that if the stage 1, you can safely say that the cure rates are more than 80% for any types of cancer. If it is stage 2, it's more than 60%. If it is stage 3, it's around 40%. If it is stage 4, the 5-year survival is actually less than 20%. So stage 4 cancer patients, only 20% would be able to live up to 5 years. So this is a very fairly easy layman's figure to remember. 80, 60, 40, and 20. So stage 1 is 80, stage 2 is 60, stage 3 is 40, and stage 4 is less than 20%. So what we can do, actually, we need to empower our society so that more patients, if they are going to get cancer, they should present early in the stage 1 or stage 2 in order for them to increase the chance of cure. We don't want patients to present in stage 4. So that's why screening, as you say, Vance, is an important tool. But unfortunately, we don't have a robust test as well as yet at the moment that we can use to exclude somebody's risk of getting cancer or otherwise. The next question is, are all cancers equally aggressive? Is breast cancer as equally aggressive as a lung cancer? Or is a brain tumor is more aggressive than a lung cancer? Then we have this slide from Journal of National Cancer Institute from the America, and it shows the 5-year survival rate for most common cancer sites. And this slide is very intuitive for laymen and also for doctors as well. Now, from this slide, you can gather that there are good cancers and there are bad cancers. Now, the good cancers to have is prostate cancer at the top, where in the years 1970s, the 5-year survival was 67%, and now we are coming to 99%. And that is being followed by thyroid cancers, 98%. Then you have melanoma, skin cancer, 93% at the moment. Breast cancer, as we have mentioned earlier, is 90%. Then we have womb cancer is 86%. Bladder cancer is 78%. Now, where is lung cancer? Lung cancer is in the bottom 3, really. If you look at the left bottom side of the chart, the bottom 3 worst cancers to have are lung cancer with only 18% survival at 5 years, liver cancer 18%, and pancreatic cancer, cancer of the pancreas, only 8% would survive despite best treatment. So this is a very intuitive slide, actually, Vance, that informs us. I mean, if there's a question that if, let's say, God is going to, is a very hypothetical question. If God says that I'm going to give you a cancer, but I give you the liberty to choose which cancer that you want to have, this slide is going to be very useful for you. So don't choose pancreatic cancer, liver cancer, lung cancer. Please choose prostate cancers or bladder cancers and so on, which has a better outcome. So every cancer would behave differently, and they have different survival rates different outcomes as well.
From this slide, it's a very clear view of picture with statistics and numbers.
Yeah,
I will assume the last bottom three, which is the lung, liver, and pancreas, I think is very vital for the human performance. Like the pancreas does,
exactly.
job liver does is detoxifying, and lung is the oxygen respiratory with carbon dioxide. So I think when these three vital, the most important
Absolutely.
thing, when the cancer attacks the cells, then I think the survival just drops
Yes,
tremendously.
yes,
Um,
exactly.
it's doctor is like a bit of hypothetical, or rather, I would say it's not fair. But a guy who's really super fit.
Yep,
Again, I'm back to the three lists that you gave.
yep,
But even though if it's not DNA, if it's not the lifestyle, if it's not because of adherence, what is it exactly that is this just popping up to someone and said, "Oh, you're gone in 3 months." It's a bit,
yeah.
in that,
Traumatizing.
yeah, it's a bit of. I rather say it's more emotional, and for the family members, especially the person
Correct.
who, if someone is living so happily,
Yeah,
full of life ahead, and suddenly you can tell him, you have 3 months to live, and probably the whole life shatters at him. A lot of psychological disturbance,
exactly.
maximum level. One part is a physical, one part is psychological. I think
Yeah,
it's like what you said. It's the worst kind of a disease anyone
yeah,
should have, and
yeah,
we hope that there's some miracles soon in the medical field to have a cure, or regular testing
yeah,
to be able to
yeah.
identify.
Yeah, actually, on that note, actually, Vance, for example, lung cancer, although the treatment for lung cancer isn't robust, for example, meaning we can't cure lung cancer patients as robust as a prostate cancer, but what we could do for lung cancer is we could prevent it at the first place. What we understand from lung cancer is 90% of lung cancer is due to cigarette smoking. So from tobacco smoking, meaning to say, if in Singapore you have 1,000 cases of lung cancer, 900 cases are attributable to smoking. Either you are an active smoker or you are a passive smoker. So if let's say that the whole Singapore stops smoking, you would have very least number of lung cancer patients. The other 10% of patients who have lung cancer, the cause of it is mainly caused by pollution, air pollution, pollution from industrial pollution, if they're working in factories and so on. So again, that's something that the government can do something about in order to have a clean, healthy air, avoiding all the factory air pollutants and so on. So actually, lung cancer is something that we can actually, if everyone works together, we can actually make it as a very, very rare cancer if our surrounding is really clean. So that's something that we can actually work about, but it has to have a lot of determination from everyone. Really, it's not an easy thing to do.
Because it's some kind of a not say a lifestyle, but it's kind of
Exactly. Yeah.
someone has it, and it becomes, because I do know. There's a quite number of high percentage of population who smokes.
Yeah.
Those who are not smoking is a passive smoker who stand beside, the guy is blowing off, and in that
Yeah.
particular person is breathing in, so it become a passive smoker as well.
Correct.
But everybody takes this seriously. I think you can keep all these unnecessary problems at the low,
Exactly.
lower. I like what you said,
Exactly.
more collective kind of a thing that everyone has to put in to make sure that it's safe for themselves and safe for the family.
Yeah.
Because when you bought this, I can tell you that when I was young, my
Uh-huh.
dad, right. Possibility that's also one of the highest risk factor that he has.
Ah.
But when he smokes, he's very
Uh-huh.
confident. He will go away as far away from the family, maybe
Right.
like
Yeah.
meters, or maybe 25 meters at least away, and he never
Yeah.
smokes. He smokes far away, so he knows that one part is harmful for the family, but at the same
Yeah.
time he didn't realize that it is also harmful for him, but which he
Correct.
probably addiction, because of that kind of sensation. Because most people who go for cigarette breaks, um, probably I would think it's maybe they want to have a relaxed time, like
That's
a
right. Absolutely.
stress situation. They just want to go, okay,
Absolutely.
and they tend to relax a bit, which is, I think it's an
Yeah.
addiction and it's an habit. I mean, like it can lead to a more serious problem may
Correct.
happen, which is if
Correct.
probably everybody try to kick off the habit, that will be wonderful.
Correct, absolutely. That's very right, Vance. But again, during those times, the awareness about the link between smoking and lung cancers were not that clear at that time. So again, the awareness level, and even the doctors wouldn't know how strong is the linkage between smoking and lung cancers. But now we have more data about it. We know that 90% of lung cancers are due to smoking. We didn't know about it before. So, in fact, now we can actually make a change. And who knows, in 10, 20 years' time, we could actually eradicate lung cancers without any treatment. We just have to adjust our lifestyle,
Yeah.
avoid the cigarette smoking, avoid the air pollutants, and so on. And who knows, we can actually make lung cancer something very, very rare.
Thank you, doctor. So we can
Okay.
go
Shall we
further.
go to the next slide?
Yes,
Okay,
doctor.
right. So this is again this question is in sync to what we have actually just now discussed. So how do I eliminate my risk of getting cancers? Actually, we cannot certainly eliminate it entirely by 100%. We can't. But what we can do is we can reduce the risk of getting cancers, and the thing that we can adjust our lifestyle factors and dietary factors, environment factors. And this is a very beautiful chart designed by the Cancer Research UK, and it puts all the causes of the modifiable causes of cancers in one very informative chart. And if you could see here, of all cancers, the biggest elephant that is causing cancer is actually number one is tobacco. So if you look at tobacco, that's the biggest elephant in the room, followed by being overweight, and number three, you have a low fruit and vegetable diet. So we are taking less fruit and veggie as opposed. Excessive use of alcohol, occupation as well. Some people who are exposed to certain chemicals or ultraviolet, they are being exposed to risk of cancers. For example, latex workers, they are at risk of getting bladder cancers. People who work in the paint industry, they're exposed to again bladder cancers. And people who work in a wood or dust, in the wood dust factories, they're at risk of getting lung cancers. Construction workers who are at risk of getting lung cancers. Sunlight and sunbeds are mainly attributable to the Caucasians, where the fair skin actually is really not designed for hot sunny weather, and they tend to get skin cancers. But in our part of the world, it's very relatively rare to have skin cancers in comparison to the European countries. Infections, there are some infections, for example, virus HPV infection in women can cause the cancer of the cervix. And we have a very effective vaccine for it, really, which can eliminate the risk of cancer of the cervix by 90%. Red meat. So red meat is a known cause of cancer actually, Barnes. By definition, red meat is beef, mutton, lamb, and so on. So that this is in contrast with taking white meat. White meat is perfectly safe to consume, but red meat has got risk, especially to cause bowel cancer. And if you look at it properly in this chart, where it breaks down causes of cancer according to the type of cancer, the main cause of getting bowel cancer is red meat consumption, followed by being overweight, and followed by taking low fiber diet. If you look at lung cancer, the main cause of it is tobacco, followed by occupation, then is low fruit and vegetable diet. So nobody have thought that fruits and veggie have got association with lung cancer. But it is there really now. More and more evidence are coming in. And if we go through the other risks of all sorts of cancers, radiation, improper radiation use in factories and so on can lead to cancers. People who take low fiber, they are at risk of getting cancers. People who are inactive, meaning they have a very sedentary lifestyle, they are at higher risk of getting cancers than those who do exercise and being active regularly. Not breastfeeding is a risk factor of breast cancer. So, women of childbearing age should breastfeed their children in order to reduce the risk of breast cancer. Salt actually is not the salt that we tend to normally use in cooking, but salt that you use to ferment food. That is associated with cancers. And HRT last is the hormone replacement therapy. So for females who have undergone menopause at a young age, if they are going to take hormone replacement, they really have to be counseled. If they have risk of familial risk of cancers, then they really need to take it very, very cautiously under strict supervision. So this is a very one of my favorite charts really that actually depicts what we can actually modify in our lifestyle in order to reduce our risk of getting cancers. And you can actually get it from the a lot of good charts, a lot of infographics that you can get from the website Cancer Research UK. Should you are interested to look for it. And the other two things that is not in the chart, but it is already documented in the by IARC, which stands for International Association of Research on Cancer by the World Health Organization, says that processed meat and salted fish are the two category one risk factors. The definition of category one means that there's a strong evidence to link this food to cancers. So processed meat, by definition, the sausages, the burgers, and so on, have got links to cancer. So it's best to cut down to reduce it. You don't need to fully stop taking processed meat, but you just have to reduce the amount that you're going to take. Don't do it frequently. Make it occasionally. From the dietitian's point of view, if you're going to take processed meat, not more than once a week is probably fine. But don't overdo it really. I mean, don't do it every day. That's really not healthy. And salted fish is something that you can easily avoid, I suppose.
Even doctor, when we talked about
Yeah.
food wise, especially the
Uh-huh.
processed meat, the processed meat, can it be anything, right? Like a hot dog or fish ball or so and so forth.
Exactly.
But
Exactly. Yeah.
I mean, I'm also a culprit of that. But it's so tasty. It's
That's
very,
right. That's right.
but we humanize, we do not know what is going into it, right?
That's
Um,
right.
all it can be peppers, or it can be the all the artificial, unnatural, artificial,
Exactly.
or
Yeah.
something that's going in for
Yeah.
sure. That's why the meat is cheap and possibility is so tasty, and
Yeah.
it's also
Exactly.
fast process, right? I mean, that's why people
Yeah.
always want to go on a fast process. They want to have it. So I think because of lifestyle,
Yeah.
uh, and I think as the era is changing, we want everything fast and everything right.
Exactly. That's
So
right. Yeah.
and cheaper. So that probably
Cheapest.
one of the answers why in my home,
Yeah.
I like to quote that cell. We try not to take any hot dogs because
Yeah.
for some reason, if you don't see the meat, then
Yeah.
probably you don't want to buy it because probably it's tasty, right? I mean, if you are doing a barbecue,
Yeah.
what barbecue without hot dogs, right? Hot dogs are the main thing.
Exactly. Exactly. Exactly.
But you're not sure what you're putting inside the body. It's good for maybe about 5 seconds until to your
Yeah.
taste buds, and then after which, when it goes inside,
Yeah.
then probably you're not in control.
Yeah. The pleasure is no more. Is as you say, the pleasure is only for 5 seconds, and that's it.
Yeah, I mean, a lot of us will take hot dogs with the chili sauce. I
Yeah.
think probably every one of us are culprit for that. But at the end of the day, it's just 5 seconds for the taste
Yeah.
and probably permanent for the
Yeah.
human. So we need to make that balance. and I think it's awareness is very important. People know that, but sometimes
Yep.
they just do it in a very moderation. But those
Yes.
are another extreme part where they totally cut off and they're going under a strict vegetarian or
That's
single
right.
plants and so on and so forth.
Yeah.
I think
Yeah.
there are certain reasons, but
Yeah.
probably it's best to cut down all these to avoid unnecessary problems for the human body.
Exactly, Vance. But as you say, the temptation for processed meat is very high. It's a very convenient food. You can actually prepare it in the morning if your children is going to school. It's very easy to prepare for them. Very time saving. If you are really hungry for lunch or dinner, the takeaway is just there around the corner. Drive through is there, especially now during COVID times. So it's not easy to run away from processed meat and so on. I would probably say we can be very selective. If you're going for like fast food and so on, you could go for example, if you're going for the chicken or the fried chicken, it's more fresher than going for the nuggets or the burgers. So you can be a bit more tactful in that. That yes, you can enjoy the fast food, but go for the fresh meat rather than the meat that probably have kept for months. We call it as a processed meats. Yeah, we can still have a bit of room for enjoying those kind of food, but being a bit more selective, really. Yeah.
Yeah, thank you, doctor.
Okay. And how do we treat cancers? So it depends on how the cancer has presented. If the cancer is localized in one part of the body, then we really like for the cancer to be taken out, either by giving surgery, either by undergoing surgery, just remove the tumor, or blasting it with radiation. We call it either radiosurgery or radiation therapy, and just to eliminate the tumor. Now, the principle of cancer treatment is if the tumor is localized, the best way is still surgery, just to take it out, remove it. But in some cases, the tumor is located at a very eloquent area, a very tricky area where the surgeons cannot just go in and access. For example, Lee Chong Wei's type of cancers, the back of the nose. If you are going to do surgery at the back of the nose, we cannot have the confidence to be able to take out the whole tumor easily because it's not the most accessible site. So in that kind of cancers, we don't use surgery. What we use is we use radiation therapy, we use radiosurgery, and so on for tumors in the eloquent area. Now, if the tumor has spread, or if the tumor is a blood-borne cancers, a blood type of cancer, blood cancers like leukemia or lymphoma and so on, then we have to use systemic therapy. The definition of systemic therapy means you give a drug, it travels everywhere in the body, wherever it finds the cancer cells, it kills it off. So the systemic therapy comes in a hormone form, in a chemotherapy form. Nowadays, we have the monoclonal antibody form, targeted therapy form, and immunotherapy form. I'll go through with it shortly after this. So, what is systemic therapy? Systemic therapy is any treatment is being delivered via orally or by injection that is capable of diffusely traveling throughout our bloodstream to kill cancer cells. Hormonal therapy, for example, some breast cancers are due to the female hormones, the estrogen and progesterone. We have anti-estrogen tablets, which can be very effective in preventing the cancer from spreading, in curing cancer patients, and we use hormone therapy in those patients. Majority patients would need chemotherapy where it is some chemotherapy are made from chemicals, some chemotherapy are made from plants, and there are some chemotherapy are in oral form, some chemotherapy are in injection form. There are many types of chemotherapy, and what chemotherapy does is it kills the cancer cells, but at the same time it does kill the non-cancer cells. But the non-cancer cells, it tends to grow back normally and it tends to repair itself. That's why people say that going through chemotherapy, patients may lose their hair because it's a normal cell that is being disrupted by the chemotherapy. But the hair will always grow back again. It doesn't mean that the hair loss is permanent. What it does, on the other hand, is it is capable of curing cancers. Some types of cancers, for example, lymphomas, for example, cancer of the testis in males, they can be entirely cured by giving chemotherapy alone. So, a lot of misconception about chemotherapy that patients tend to avoid, which is unsubstantiated. The next agent is monoclonal antibody. Now, monoclonal antibody and targeted therapy are fairly similar, you can say, where the difference between chemotherapy and these targeted therapies and antibodies are the cancer cell, some cancer cells would have an antibody on the surface. Now, these drugs would target on the cancer cells only. It will not target on the normal cells. So it spares the normal cells. So these patients would have comparatively lesser side effects in contrast to chemotherapy. And then we have the most newest agent is immunotherapy, where the drug does not kill the cancer cell, but it reprograms your immune system to be able to detect the cancer cells and kill the cancer cell. Now, what we understand from the tumor biology, from the cancer biology, is the tumor cancer cells are very cunning. Our body has its own defense system. Now, the defense system it can be confused by the cancer cells. The defense system normally, if it finds an irregular cell or irregular foreign body, it will tend to kill it. But the question comes in, why does our immune system kills the bacteria, kills the viruses, but it doesn't kill the cancer cells? Because the cancer cells tries to evade the immune system by confusing the immune system, by telling the immune system is like, we belong to the same parent, we have the similar DNA, why are you killing me? So you shouldn't be killing me, you should be killing the viruses, you should be killing the bacteria or the fungus. Don't kill me, let me do my work. So the immune cell gets confused, and then finally it will just say that, okay, do whatever you want. Yes, your DNA checks with me, and I will not kill you. That's how cunning cancer cells are really actually once,
So
and
we
it's fascinating.
so we can say that the cancer cells trying to manipulate our own antibiotics and,
Yes, yes,
and,
yes,
and convincing say that they are one of them.
yeah,
And obviously, of course, as a whole antibiotic system, the cells
yeah,
are just basically just invading, like what you mentioned earlier, doctor. It just
yeah.
invading it and then corrupting the whole entire system.
Exactly, exactly. It is a very big corrupter. It corrupts the whole system. It bribes the immune system. It evades the immune system, confuses the immune system. If not, really, our immune system, our T cells in the body, is actually capable of killing cancer cells. Now, that's a part of research going on. Why it is not effectively killing cancer cells? Because the cancer cells is programming the immune system not to kill it. So the cancer
Hmm.
cell is smarter than the immune cells. So now we are designing drugs which is planned to reprogram the immune cell, and then making the immune cell a bit more smarter than the cancer cell to be able to detect and kill the cancer cell.
Well, that's a very interesting to know, doctor, because
Yeah.
our safety mechanism, right? We call the fighters in our
Yeah,
body are constantly fighting for from so many viruses,
yeah,
even COVID, and even before
yes,
that,
yes,
so many tons of viruses that
yeah,
we only know a little bit of that, but there are so many viruses and so much things that are attacking us, like a simple
correct.
cold and fever and stomach upset. So they're always constantly fighting without any rest. But at this
That's
point of
right.
time, we like to stress that because the cancer cells trying to manipulate our
Yeah,
actual fighters, our actual
yeah,
fighters are maybe we're going to say that they are little off guard, and then
yeah,
they try to invade it and then convince the guys and say that okay, we are all a part of a family, and then there's some
exactly. Yeah,
body system. So
yeah,
instead of
yeah,
fighting, they are working against us.
yeah, precisely. So back to the notion that cancer cells are very cunning. Really, they're very cunning, and they tend to be very aggressive. Okay, so next slide is about chemotherapy. Now, is chemotherapy is as bad as it sounds? A lot of myths about chemotherapy is like some patients die because of chemotherapy, some patients permanently get severe vomiting because of chemotherapy. Some people they get into admitted into ICU because of chemotherapy. Actually, chemotherapy is a very safe treatment, just like going through surgery. If you have a 2% risk of getting serious effect from surgery, it's the same as chemotherapy as well. So meaning to say, most patients they tolerate chemotherapy very well, and they undergo the treatment without much effect on their quality of life. And saying that there are many types of chemotherapy drugs, and more than 30 types. Each type of chemotherapy drug would have a distinct use and the distinct side effects really. Some have got very mild side effects, some are very strong, and we use based on each indication. For breast cancer, we have different chemotherapy. For lung cancer, we have different chemotherapy. For bowel cancer, we have different chemotherapy. Some chemotherapy will induce hair loss, and some will not. Some do not cause vomiting at all, and some does. And even like vomiting, really, we have a very effective anti-vomiting treatment nowadays that can really stop vomiting. Like 90% of my patients do not have vomiting at all whilst they are going through chemotherapy. So we have a lot of game-changing medication that we have nowadays that can prevent chemotherapy-induced vomiting, and they are costly, but they are very effective. So in terms of treatment, treatment has improved a lot since decades ago. Most patients have relatively good quality of life compared to previous regimes. The reason I've put this slide is because many patients, when we ask them to go for chemotherapy when they are in stage 2 or stage 3, they refuse to do so because of the stories that they hear from outsiders, from people that they may or may not know, and they paint a very bleak picture about chemotherapy. The problem is when they don't have chemotherapy in stage 2 and stage 3, once the cancer reoccurs, once the cancer occurs again, it is automatically stage 4 already once. So if let's say you have a stage 1 cancer and suddenly the cancer reappears, you have a very high chance that it's going to be a stage 4 and incurable disease already. So that's the reason why we give chemotherapy preemptively, preventively in the stage 1, stage 2, stage 3. How about radiation therapy? So the radiation therapy is a treatment where we use very, very small particles, microscopic particles that can actually penetrate the skin, goes to the organ, and deposit its energy into the tumor cell and kill the tumor cell gradually by taking its own time. Now, radiation therapy is very effective. For example, again, Lee Chong Wei, he had this radiation therapy, and he is well until now. So the way that the radiation works is we give a set of treatment. For example, for nasal pharyngeal cancers, we treat up to 7 weeks of treatment. They have this kind of treatment 5 minutes every day for up to 35 sessions, for example. So we give this radiation treatment, and how it works is I hope I can play this video, and let's see whether it works or not. So basically, the patient is going to be lying flat on the couch, and then you have, if they have a head and neck cancer, they have to wear this mask. If it is a breast cancer, they just have to just lie on the couch, and we are going to irradiate the breast. And that's how it works. The machine actually, I'll just let you watch it first. Okay, so this is a very highly precise machine where it irradiates the tumor cells and it spares the normal tissue cells. Now, the way it does this, it uses energy called photons and electrons. And when delivering the treatment, the patients will be fully alert, pain-free, doesn't require any sorts of sedation, and the treatment lasts for usually 3 to 5 minutes. And by this is a local therapy, it can kill cancer cells, it can ablate cancer cells, in stage 4 cancer, and can actually improve pain. It can reduce the complication from tumors. So and it is very expensive as well. One This sort of machine can easily cost around 3 to 4 million Sing dollars to have one machine as such. So it is a very a precise treatment where nowadays the efficacy of it and the precision of it can be as precise as 1 millimeter, meaning when blasting the tumor, we are not going to err by more than 1 millimeter really. So that's how precise treatment is for cancer treatment nowadays. Um, yeah, so that's about radiation treatment. The other popular question is that people often ask: can supplements be used to cure cancers? My simple answer will be no. A lot of people will take the opportunity to sell supplements which are unproven, which are not regulated by the health authorities, and they promise everything. They say if you take this, you can be cured of cancers or you can prevent cancers, but the harm that it may bring is really hazardous. So I wouldn't actually recommend any sort of supplements to be taken by cancer patients in order to cure cancer patients. What's most important for them is to take a balanced diet, have a healthy pot of fruits every day, and vegetables every day, do a lot of exercises. One of the things that we haven't touched actually is exercise ones. Now, exercise has been proven to reduce your risk of cancer by up to 30%. So that's a very handy thing to know. Yeah, and if let's say if you're controlling your diet uh, with all the advice that we have given so far, cutting down on the processed meat, cutting down on the red meat, and so on, how much can it contribute towards reducing the risk of cancer? It can do so for as much as only up to 10% only. So dietary adjustment can help reducing your cancer risk by 10%. But if you are doing exercise and regular exercise, the recommended regime is 75 minutes 3 times a week. That can reduce your cancer risk by up to 30%. So the weightage is more on the exercise rather than on the diet. So it's a win-win situation really. If you are doing exercise, you can reduce your risk of cancer, reduce your risk of getting blood pressure, diabetes, heart problems. So we ought to actually give time, spend time for our body. Yes, we know that we are working day and night just to earn a living, but we really need to find some time to do the honors, to do the needful for our body. Really, our body does need attention from us as well. So this will be my last slide, Vance. The take-home message for today is very important: healthy, balanced lifestyle, which includes dietary, exercise, and also our environmental factors. Screening is very important, meaning if we are in a developed countries, we should push for our governments to have screening programs for public people, for bowel cancers, for breast cancers, for even lung cancers if possible. And if any patients who have got symptoms, lingering symptoms that is unresolved for more than a week, get it checked. If you have any persistent symptoms, any sort of symptom, either pain or cough or bowel problems and so on, lingering for more than a week, please get it checked. Don't assume that it's just nothing going on and it will just get it over. It's better to be erring on the safe side. And we hope that this small session that we have done, the small information that we have taken as a take-home message, we can help and educate others as well, Vance, and uh, and then we can actually make a ripple effect. The more that we spread the news, we can actually reduce the occurrence of cancers, and at the same time, we can get the after effect of it when the risk of cancers, genetically inherited cancers, can be reduced by reducing by the reducing numbers of sporadic cancer cases. So with that, I would like to thank all the viewers for spending time with me in going through about simple facts about cancers. I hope that is useful for everyone. And I must thank our host today, Vance, for the opportunity given and for the trigger that you have done, a very noble effort that you have done so far. I hope this will go far. Thank you very much, Vance.
Thank you, Doctor. Thank you so much for the a great presentation that you have done.
My
I
pleasure.
think, I mean, it is a big topic, but then you try to put it as simple as possible. But even though it's very scientifically, when you talk about this, the viruses or even the cells that comes in our body, how they
Yeah,
try to, that was well said. But of course, I also do believe that when there's a pain indication in the human body, that something there's pain
yeah,
constantly period of 1 week, that is something that your body is trying to give you signal saying
yeah.
that there is an issue. So we should not be putting it to ease and then going off.
Exactly,
So
exactly, Vance.
that
Yeah,
is one of the area that we are looking at. Thank you
yeah,
so much, Doctor, for the this great session with us. But Doctor,
yeah.
if you have a couple of more minutes,
Sure,
uh,
sure, Vance.
there is a question that asked by one of our viewers.
Uh-huh.
Of course, we try to summarize it up as quickly as possible, but she had mentioned that some say chemotherapy actually shortened the lifespan, cause of side effects to take chemo or not.
Yeah. Okay, so that's again that's a myth, really, saying that chemotherapy shortens lifespan. Now, in bottom line, saying that in medicine, the first thing that we learn in medicine is we should not do harm. Doctors should not do harm to patients, and that is our first and foremost principle. So, meaning to say, if chemotherapy is harmful, we shouldn't be giving it to patients at all. Now, we determine that if the risk is acceptable, meaning to say that the risk is minimal with regards to the benefit is high, then only we can offer the patient this sort of treatment. So it is a well-known myth to say that chemotherapy shortens life. If it shortens life, then we should not be giving it in the first place. But a lot of robust clinical trials, clinical studies, patient testimonies have shown that chemotherapy is able to cure, chemotherapy is able to prolong life, and is able to improve quality of life. Actually, we have seen it's normal cases that we see daily. Patients, for example, lung cancer patients who come in wheelchair bound, they can't actually walk, or they can't actually wash themselves, they can't actually feed themselves. Breast cancer patients per se as well, and after a few cycles of chemotherapy, they start walking about, and some of them go back to work really. So it is a misconception that is there and has to be addressed. And the best person to tell the benefit of chemotherapy is the patient, him or herself, really.
Thank you, Doctor. One last
Really.
question before we call it the end for today's session.
Sure.
Um, this is also by this particular viewer. In the
Uh-huh.
market, there is a DNA test to calculate the risk for cancer. Do you recommend to take such tests?
I wouldn't at the moment, actually, Vance, because there is no certified DNA test by the relevant authorities, either by the US FDA or by the European, to say that there is a robust test that calculates the risk of you getting cancers and so on that should be advocated to patients. No, not at the moment. Yes, we are aware of companies offering such tests, but we really need to be robust about it, that it has to be backed up by proven, strong clinical and scientific evidence. Without strong clinical and scientific evidence, we should not be buying into this test. And for the authorities that we should be referring to, for example, is the National Institute of Clinical Excellence in the UK or the US FDA authorities. Now, the UK body, for example, they really look at the evidence to see. They really scrutinize the new technologies, for example, this DNA and so on, this DNA testing and risk of cancer. And unless there is a strong scientific basis to accept it, they will not accept it. And until now, it is not being used in clinical practice in the UK at all.
Thank you. I hope that will be address her question. I mean, for the answers that she asked for the questions. Thank you, doctor,
Yeah,
so much. We agreed to only to be around 40 45 minutes, but it really went on about one hour and 25 minutes. And
no problem, Vance.
even with your despite your hectic life schedule, I think you really spend that great amount of time with us, and I we have to great I mean, I'm just grateful for that the great session that you had and you explained, and I'm sure this is a recorded version, so it will be there, and for more viewers to come and look at it and get benefit of this, what is this all about cancer, and you explain it in fantastic way. Thank you so much, doctor.
My pleasure, Vance.
So we will get connected again, doctor. Thank you so much again, and a pleasant week ahead for yourself, and we will get connected after this.
You too. Have a great evening, Vance.
Thank
Take
you,
care.
doctor.
Nice to speak to you. Nice to know you, Vance. Good
Thank you, doctor.
man.
Bye bye. All right, thank you so much. So that's about 1 hour and 26 minutes of Kopi with fans. And yes, we have covered a huge amount of talk on the particular topic of cancer. I'm sure some of you all might have lost your loved ones to cancer as well. It's very painful. Like what doctor has said, there isn't any a test to find out at this point of time if there's pains and syndromes that's coming up along the way. Like it's always good to get checked up, even for your regular blood pressure. We're not even talking about cancer, but we're even talking about a bigger various of topics that for keeping yourself good, eating healthy, try to avoid processed foods and certain things. We all know about that, but it's just that sometimes we are too busy with our lifestyle that we tend not to pay attention to it. So I think it's a great session. Thank you so much for all the comments that keep on coming in. If you do want us to cover a certain topic on Kopi events, either on fitness or anything that's related to the human performance or the mind, the body, I'll be very glad to. So do send me a message and we try to cover that in the next topic. All right. Thank you so much once again for spending this your time with us and all the questions that you posted. I'll catch you again. In the meantime, that's a cup, Kopi with Vans. I'll catch you around.